Jerry Candelario, Director of the Asian Pacific AIDS Intervention Team.
Good morning, everyone. I'm Jerry Candelario, the Director of Asian Pacific AIDS Intervention Team. We provide prevention, treatment, research, and training services for Asian Pacific Islanders here in Los Angeles and in Orange County. As we speak, the legislature will be deciding the fate of critical services that are vital to Californians who are living with or at risk for HIV/AIDS. The governor's proposal would cut $80 million from the State Office of AIDS Programs, cuts to HIV counseling and testing, epidemiology and surveillance, therapeutic monitoring program, home community-based care, prevention education services, and the life-saving AIDS drug assistance program. The proposed cuts jeopardizes California's ability to deliver life-saving medications to low-income people with HIV who cannot otherwise afford them. The AIDS drug assistance program, for instance, provides treatment for nearly 35,000 low-income Californians. Cuts of this magnitude will increase morbidity and mortality from HIV and ultimately raise state costs as rates of HIV illness and infection rise. The additional cuts to the state HIV/AIDS budget will also cripple already underfunded local programs. California has served as a model for the nation and world for its response to the AIDS epidemic since the early 1980s. We understand that California is in an unparalleled budget crisis. However, we cannot solve California's economic crisis by putting Californians with HIV/AIDS further in peril and imposing cuts that will result in the spread of HIV/AIDS. These cuts simply do not make sense. Cuts in AIDS funding will increase emergency room visits. Cuts in AIDS funding will threaten matching funds that we receive from the federal government. Cuts in AIDS funding is simply inhumane, short-sighted, and a threat to the community and public health. Cuts in AIDS funding equals death. We urge you to stand up and show the governor and our legislature, who are our public servants, that these cuts will simply not be tolerated. Stop the cuts, stop the bleeding, stop AIDS.